how I think about reaming the acetabular component. First is I level the pelvis, and then I do some things with my first reamer that might be a little bit different than the middle reamers and then final reamer. And so in general, I'm aiming to use 2 or 3 reamers, 3 millimeters under, 1 millimeter under, so I get a 1 millimeter press fit. And I'll give you some examples. So just real briefly about the OR setup. So we have the instruments back table on the surgical side. We have the fluoro come in across the non-operative side, and then I have the fluoro base on the opposite side down by the legs. And I like to look down at the screens on the fluoro base as opposed to the screens up on the boom at my hospital. The fluoro base screens are a little bit more high definition. So this is the position that I'm standing in when I'm reaming for the cup. I've got capsular tags, so number 2 stitches, 1 on the anterior capsule flap, 1 on the posterior flap. So I work my reamers in around those, and standing here. I've got an offset reamer. I have the reamer handle rotated 90 degrees to the side, and it's left to right specific. And so the brief point I wanted to make about the ergonomics for reaming, you can adjust the table height, raise or lower it based on your height and what's comfortable for you. So when you have those cases where you have that really dense sclerotic bone and you really have to lean your body into the reamer, being able to adjust that table height in a fine-tuned way really helps to facilitate that. And then similarly, if you want to slightly increase the anteversion of your reamer, you can just lower the table 1 or 2 clicks,